how we can improve our immune system to fight against COVID-19. And the second part is, do you think like boosting our immune system will really help to fight against COVID-19? And what kind of vitamins that we need to take, what kind of food that we have to intake?
Definitely, like I said in the beginning, that different people. I mean, people might get infected, but then different people, they present with different symptoms. That and 80% of them, they come out of it. That's also because they have a good immunity and they're able to fight the virus, right? So having a good immunity is very, 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 very essential, right? So how do you really boost your immunity? One, diet, nutrition. Now all of us know what we have to take and what we don't. But then just to again, if I have to just put it, lots and lots of vegetables, fruits, whoever is able to take it. But because of course what I'm saying, it depends on your medical condition. If anybody is having diabetes, you're not going to eat lots of fruits, right? You're going to balance it out according to the way your sugars are. So including fruits and vegetables, including proteins, including dietary fiber, that is very essential. Having lots of water, good hydration is very, very important. Then talking about vitamins, there is this whole talk about vitamin C, but there is no definite data that, okay, vitamin C really helps in preventing COVID-19. People go for something like, we back home, and in all our food, we have turmeric, which is put, but then the WHO says that, mango, turmeric, there is no definite evidence, if they help in preventing COVID-19. That is what it says, but then there is, however, there might be some role of vitamin D. But vitamin D also, when I say that, not everybody takes, it's not like one size fits all. It depends. Right. You'll have to contact your doctor. And if they think that, you are a candidate for vitamin D, you will be given the tablets, Otherwise, just to take all these supplements and antioxidants, there is no definite data available saying that, these are really going to help in preventing the disease or anything like that. That is what it said, right? Having said that, bringing down your stress is definitely going to help. I know it is better said than done, but then, we are coming forward, and then, I'll give you practical tips, where you'll feel like, maybe it can help you bring down the stress levels. Exercise is something which is very important. Now, exercise sounds so boring, I know, because even I find it a little boring, but then the reality is, especially at this time, when most of the people, they're locked down at home, essential exercise becomes very, very essential, or some form of physical activity. Now, the WHO says, 150 minutes of moderate intensity physical activity, or vigorous 75 minutes physical activity. So when we talk about 150 minutes, now considering that, okay, everybody is at home, I think moderate intensity activity would be jogging on a treadmill, walking on a treadmill. If anybody has elliptical trainer at home, those.
Yes, exactly.
That would be moderate intensity. And vigorous activity would be something like jumping ropes.
Or maybe if they have weights at home, do you think that
carrying weights
considerable as
that would be this one? Yeah.
Or maybe push-ups, chin-ups. Maybe they can do those burpees and all those exercises.
There is I believe that people who you are somebody who probably exercises, I think.
No, I do. I do take care of myself. Absolutely, yes.
Yes. So what I was going to say is, when I talk about exercising, so generally people who already have exercise as a part of their lifestyle, they know what they have to do, right? So I think I'm addressing more people, than, who don't know what to do. So for those people, generally when my patients say that, okay, fine, now how do I lose weight or how do I do this? I just tell them, don't become PT Usha. It's okay. No need to run fast. Just start walking, have some kind of physical activity, because I just tell them that something is better than nothing. So just start some form of activity and you're good, and then you can build up on that. So exercise definitely helps to bring up the immunity. It gives you good sleep. You can prevent weight gain.
Yes. And I think especially people now, they're working from home, they are lazy, like slouchy, sitting in the bed, and with some pillows on the back, getting more comfortable, laptop in their laps and sitting for hours, and having a cup of coffee next to them and just working with headphones.
Coffee, please try and avoid caffeine.
Oh, it's not recommended.
I don't think caffeine is a very good thing, especially people who take it early in the morning,
Okay.
Please,
so what they should take? What do you advise?
I think you can replace it with maybe some fruit juice or something like that. I used to have before. Right now, I've become a little bad. I used to have this mix of, it was like a vegetable smoothie.
Okay.
So it's
All
like
right.
there was avocado and there was some form of greens and any vegetable that I would just find, and maybe a fruit at the end of the whole thing. So you can have that kind of a thing, and don't
Okay.
strain it. I never used to strain it. So it's like if you don't strain it, it's going to be even better. But then if you're not able to tolerate all that, so at least you can strain it and begin your day that way. So it would be
Great
good.
information, doctor. A lot of people, they are appreciating you a lot. We have Tamanna again. She's saying she's very, very knowledgeable. I mean, like, I am super honored right now. Thank you very much, guys, for your comments and your active engagement. And of course, excuse me, the first time when I spoke with Dr. Nabila, the first thing was like, I liked her energy, and she's a giver. And she said, like, let's go for it. Let's go for it, And there is no other person that I could at that time thought, who could come on this show and share those insights. And, you already have seen the best way that you can protect yourself. And she has explained how you have to wear the mask. In case you have just joined us, you can always watch back this whole episode. And there's a part where she has explained how you have to wear the mask. And she has explained very clearly how you have to wash your hands for when it comes to 20 seconds hand washing. It's not just, you put your hands and you just start rubbing for 20 seconds and it's done. There are 7 steps which she has mentioned. So I recommend you to go back and watch it again. And also I strongly recommend I suggest you, instead that, after this live broadcast, please take this link of this live broadcast and share it with your friends, share it in your WhatsApp group, share it in your, other social media platforms, so that we can have more and more people. And, this information which Dr. Nabila has shared with us, reach out to more people who, right now, as you said in the comments, like, this is the first time that you are knowing how to wear even the mask. So, there might be a lot of people who are, not knowledgeable, or they don't have access to social media. They don't have access to this kind of information in this detail. So I think, you can play your part. I have played my part today, to make an effort to bring Dr. Nabila on this show for all of you. And, now after this live broadcast, it will be your responsibility as well. Take it a request from my side to please share the link with your friends and in your WhatsApp group. We are all the time active on WhatsApp groups, but also, if we can share this information with our other friends, maybe with our family members, with our relatives, I think we definitely can help a lot of people. And of course, we can share people's lives as well. All right.